And yep, I just got that. And without further ado, I'd like to introduce Mary Newman, who's our esteemed CEO and president of the Sudden Cardiac Arrest Foundation, and also she is one of the founders of CASA, and co-chair with her and Alex Prizzuto. And take it away, Mary. Thank you.
Thanks, Joe. Good morning or afternoon to everybody. I'd like to introduce our speaker, Sarah Perman. And Sarah, did you jump off? No, you're there. Phew.
I hope I'm still here.
Okay. It's really an honor to have Sarah speak with us today. Sarah is an MD, associate professor of emergency medicine at the University of Colorado School of Medicine. She obtained her medical degree from Temple University and completed her general emergency medicine residency at the Hospital of the University of Pennsylvania. She then completed a resuscitation research fellowship at the University of Pennsylvania Center for Resuscitation Science, while also obtaining a master's degree in clinical epidemiology from Penn. Dr. Perman is an active member of the American Heart Association, where she works both nationally and as a member of the Denver Board of Directors. She is currently vice chair of the AHA 3 CPR Council and co-chair of the Resuscitation Science Symposium, which takes place in November. She's an investigator in the Ludeman Center for Women's Health Research at the University of Colorado and receives funding for her research from the National Institutes of Health and the Emergency Medicine Foundation. She's also a member of the Sudden Cardiac Arrest Foundation Advisory Council. Dr. Perman's clinical interests are focused on post-cardiac arrest care and acute critical care in the emergency department. Her research is focused on disparities in cardiac arrest outcomes, complex decision-making in post-cardiac arrest care, and neuroprognostication for comatose survivors of cardiac arrest. So as you can tell, she's quite accomplished in this area, and we're very honored to have you, Sarah. Thank you.
Great, thanks so much. This is really an amazing opportunity for me because it's not very often that I get the chance to have a conversation, a very informal, casual conversation with survivors, co-survivors, and people like myself who are often on the other side, providing CPR or potentially engaged in resuscitation. So I'm hoping that as we move forward, this can be casual and that we can all kind of share our thoughts and maybe kind of learn a little bit from each other's experiences and think about ways that we can move forward. I don't have a big lecture to give to you. I know often when we provide webinars, we do a lot of talking at each other, and I thought that this would be a nice opportunity for us to talk amongst each other and with each other, because I think what I want to talk about today is something that I'm becoming very aware of, and I think is a little bit new because of some of the heightened situations in the public right now. But hopefully this will be a good opportunity for us to learn more and to think about how we can move forward to support each other. As Mary mentioned, I'm an ER doctor, and oftentimes people say, well, that's funny. You know, do you ride around in an ambulance, or do you train people in the community how to do CPR, or do you, are you the person that takes care of a patient for a couple minutes and then goes by the wayside? And I'm a little bit unique in the sense that I think about cardiac arrest from start to finish. So I think about cardiac arrest from the community response and how we approach patients who have or how we approach individuals who have events in the community, but also how we think about how we respond to them rapidly as pre-hospital providers, how we respond in the emergency department, but then also how we take care of cardiac arrest survivors in our intensive care units, and how we do our very best to support helping families make decisions about their kind of long-term recovery. And we've really moved very quickly into the environment that I think you all are experiencing, which is survivorship or co-survivorship, and thinking about how we can better support, how we can learn from you so that we can create more resource and support your colleagues, your peers, my colleagues, my peers, to do better. So that brought up this topic today, which might spark a little feeling, might spark a little bit of input from the group, might make you want to share, maybe not want to share. I'm completely open to however we need to move forward. Again, I want this to be a little bit more informal than kind of the lecturing format. But I want to start by kind of sharing an experience with you that I had. Mary, can I share my screen real quick? So I will start. So I've been at the University of Colorado for about 10 years. And, in my line of research, I often think about how to make contacts within the community, how to make contacts with survivors and with their families so that I can learn and understand. And one day in the emergency department, I saw a patient who was coming in with some questions about her ICD. And so I went in to just kind of answer the questions about the ICD, and I learned that she was a survivor. And I learned about her story, and I learned from her, but I also learned from her partner who was in the room with her about their kind of shared experience where he provided CPR to her, and she was successfully resuscitated, and she had an ICD in her chest, and she now was, kind of moving into this new experience of survivorship. And we kind of struck a friendship, and we've kept in touch. And we keep in touch over social media. And every now and then we keep in touch in person, but for the most part over social media. And something happened in 2021 where I immediately thought I need to reach out to her. And I'm going to put this up and show you what happened. So I was watching TV and I was learning about this event that happened overseas on the soccer pitch, where Christian Eriksen, who is I think I want to say he's a midfielder, I can't recall exactly, was playing in a professional game, and he just collapsed. And I watched this, and I watched the response, and amazingly, he was resuscitated on the pitch, and he was awake when he rolled off on an ambulance stretcher. And I kind of thought to myself, I was like, oh gosh, I was like, it just happened. It's really happening. Something like that is always so dramatic. And immediately I thought of my friend, and the experience that she had. And, I went to social media and she had posted, and she was like, wow, to see this is really dramatic. And I sent her a message and I said, how are you doing? How are you feeling with this being so public? And very quickly she got back to me and she said, I'm okay. She's like, I'm actually okay. She's like, my husband's a mess. And I thought to myself, I was like, this is really fascinating. And this is really important for us to learn. Because essentially what she was sharing with me is, I wasn't there. I didn't experience it. I'm seeing this on TV. I'm seeing this in the newspaper or on CNN. And I'm thinking to myself, that's probably what happened to me, but I don't totally know because I wasn't there. Whereas for him, it was a relived experience. And so it was really fascinating. I immediately said, what can I do to help? And she's like, no, we're working through it. We've got our family and our outs and our, these scenarios that we work through. And so, we kind of signed off, but in the back of my head, I thought to myself, I was like, well, we need to really pay attention to this, because the experience for survivors when they see these things in public, coupled with the experience that their caregivers, their loved ones, their co-survivors, the individuals who provided CPR, those are very different. And we need to learn about these so that we can find a way to better support. And so, this happened a handful of years ago, and it kind of was in the back of my head along with COVID and, all the other things that have been kind of moving parts recently. And then, I'm going to go back to the screen, but I'm going to move on. And then very quickly, this happened. And I think Mr. Hamlin's cardiac arrest that was witnessed by many of us on Monday Night Football was another kind of reminder to me that we need to start talking about this. We need to think about this, and we need to start coming up with an approach to how to help families and individuals in this scenario. Because I think the difference with Damar and his event is, one, I mean, you know, we're most of us, I think all of us maybe, are here in the United States, where Monday Night Football is almost like, I mean, it's a staple in my house. I imagine it's a staple in a lot of people's houses. And for this game, which was between two, you know, top contenders, very late into the season, I think a lot of people were really tuned in. And I think something happened that a lot of people have never, ever witnessed before, which is Damar Hamlin, of course, suffered a direct blow to his chest in a tackle, resulting in commotio cordis that resulted in an arrest, a cardiac arrest. I think a lot of the public doesn't see this frequently. I think a lot of survivors don't see this frequently. I think, unfortunately, for our co-survivors and our bystanders, this is something they did see, and they're still potentially processing it. And so I think it happened. And I think, unlike Mr. Erickson, who was resuscitated on the field and wheeled off awake, unfortunately, Mr. Hamlin was a little bit more critically ill. And so there was a period of uncertainty where there was a lot going on and people didn't know if he was going to survive or not. And so I think what we experienced in that scenario, and what I'm hearing that we all experienced in that scenario, was this exposure that potentially sparked a lot of emotion from people who are living in this space. And I fear, and you guys can tell me what you've experienced, but I fear an additional insult, because even with Damar Hamlin and watching the news every day and waiting to see if he would wake up, I think not only was it the event or providing CPR, but maybe for some of our survivors and our co-survivors, it was also that experience of uncertainty, which is incredibly uncomfortable. So I think, you know, right now we're in a place where, you know, these events have happened. There have been a handful in between, maybe not as getting as much publicity, but they've happened. And I think that they have affected our community. They've affected our CASA community. And I, you know, from a clinician standpoint and from a standpoint of thinking of ways to develop and implement interventions to support survivors and their co-survivors and bystanders, I would love to hear from you guys. If you've had experiences with what's been going on in the media, if you have questions about what's been going on, if you have thoughts, if you've experienced your loved ones having strong feelings over these events, I think this is a great place to bring this, given the shared experience. But I say shared with so many unique aspects, because while we say shared, everyone's situation is so varied, and their experience is so varied, and their emotion about it is so varied.
Can I'll give a quick comment, Sarah?
Yeah, Mary,
after that happened, the day after, I think I got about 10 different calls from survivors who were really shook up about it. And it seemed like, even if it was 10, 15 years ago, it was still traumatic, and it triggered some PTSD, that kind of thing. So that was my experience.
yeah.
But you can unmute now if you'd like to chime in.
Mary, I think it's great that people reached out to you, because that's always my fear, is that sometimes we experience these things and we don't reach out. So Frank, let's hear from you. Frank, can you hear us?
Oh, sorry, my apology. I appreciate that, you know, probably the AHA guidelines for cardiac arrest is somewhat different where I am in England, okay? But one thing that I think you're talking about that athlete that had the high impact. He ended up with a condition that I never even heard of, something like Komodo cardis. So I'm not, you know, it isn't the same as developing over the years coronary arterial disease, which will at some point, or maybe not, manifest itself into some kind of cardiac condition. And certainly, if I'd known after my third heart attack and a quadruple heart bypass that I was going to, you know, 20 years later, have a out of hospital cardiac arrest while playing football, I would have done something about it to change my lifestyle, because it was, and then being discharged, as 80% of all people over the age of 65 with a diagnosis of, you know, New York Hospital Association class 2 heart failure. So, but I'm not my diagnosis, I still play football. So I think in some ways it very much depends on, you know, your take on it, because the thing that frightened me was the arrhythmia nurses, when I had my ICD implanted, come to talk to me about end-of-life palliative care. What the hell? They want to talk to me about stuff like that, and I sent them away. So every day I do over 10,000 steps a day. Not that I need to do 10,000, it's just a target I've set myself. So I'm nowhere near to, I don't know about other people, nowhere near to fatigue, fluid accumulation, breathlessness, or any of that nonsense. So in some respect, I don't know, maybe I'm just lucky, or the cardiologist and the echocardiogram got it wrong in terms of my ejection fraction being 30. So I don't know, I think there's every person here that's experienced cardiac arrest can tell a different story, not necessarily remember what occurred at the point, but I was lucky because in England, only 8 out of 100 survive. You cannot, as you know, you cannot survive a cardiac arrest on your own. So I was very fortunate to be with about 30 other people. And I guess all the survivors here can tell their story about being around people. Off your guard when you're asleep in bed. That's the trouble. Thank you.
Yeah, Frank, I think those are great points that you just made. I'll say, you know, our guidelines aren't too far off from the UK. We actually collaborate very closely with experts in the United Kingdom. Some great friends and collaborators of mine. I think it's fair, right? I mean, that immediate experience afterwards, where you're thinking, hold on, why are we talking about these things? I just pulled through this is a really valid point, to ask, you know, when you saw Christian Eriksen, because of course, you know, football, I'll say, is different in your country than in ours. Did you have any, you know, did that kind of spark any emotions when you saw that happen? Of course,
No.
yeah.
The only thing that was missing in my life that I wasn't doing compared to before I had the cardiac arrest was being allowed to play football, because the group that I'm with, it's a mental health project and my son used the service. So I used to go down, have a kick about. I'm the oldest one there, but the difference being, maybe it's because of my age, but I probably did have an ejection fraction above 50 before my cardiac arrest, but I now know it's below 30, but I know people equally that have got ejection fraction with their left ventricle systolic dysfunction with a 10%, but they're still going to work full time and managing. So fair play.
Yeah.
You know, I don't know what's it. We're just going to start a clinical trial on coenzyme Q10 from August in England, and I'm a co-applicant on. And I think if we can, through the mitochondria, produce APT to give people energy that can get round the breathlessness, then there might be benefits for other conditions like COPD, pulmonary fibrosis, CFS, and fibromyalgia. Who knows? We'll see.
Wonderful.
And the beauty of it is that you know, it's not a drug that is licensed or it needs to be licensed. It's something that you can buy over the counter. So we shall see. There's not enough conclusive evidence to refute it or support it. So hopefully we'll give it a go. Thank you.
Thanks. Let's hear from some others. Kyle, did you want to say anything?
Yes, ma'am. Hi, how is everyone today?
Hi there.
Good to see you.
Wonderful to meet y'all. I really just, my question, comment, concern is, how do I get resources available to me to kind of figure out why it happened to me in the first place? Because the doctors are just like, we don't know, man. And they've done every kind of test, and I don't have like a Wolf's heart disease or what's that other one? Like Widowmaker or something like that. Like I don't have any of those. When I was 18, that was it. And I'm 23 now. And so it's like 5 years later, just past the anniversary of my rebirth. So I'm just like trying to figure out why it happened to me, how to prevent it from happening again, and how to just move on with life.
Yeah. Gosh, those are some really heavy questions.
Yeah, I know it's heavy, but like no one
No.
around me has any answers. The doctors
Sure.
don't have any answers. And I'm actually
Sure.
in film school. If there's anything I can do to help promote like y'all's business or anything, I would absolutely love to do that because I want to be a part of the community.
Yeah. Well, one thing I would say, Kyle, it would be very cool is to kind of hear your story because you're a little bit unique, and so, we can probably
Yeah,
talk about that maybe offline, a way to kind of have you tell our story, because we do have a lot of young cardiac arrest victims and survivors. And I think, like you mentioned, it is so hard not knowing what caused it, what you can do to prevent it.
absolutely.
I think that's a really challenging scenario to be in. I think it's also a very scary scenario to be in because, you kind of ask yourself, if I can't prevent it, what does tomorrow look like? And so I completely hear you. We are putting together through CASA a special group that is kind of our young survivor group.
Okay, cool.
Yeah, because I do think your scenario is unique. And of course, we have some colleagues that we work with who are young survivors as well, who had cardiac dysrhythmia. As one of our very close colleagues had a cardiac dysrhythmia playing basketball when he was, in medical school. And I think those sorts of things, right? When you're young, healthy, and active, it's very unnerving. And oftentimes I'll tell you from the medical side, sometimes we don't know. And that's the worst thing to say. And it sounds like that's what you're hearing a lot of. And so I would love to see you, engaged with our Young Hearts group that Mary can probably give a little more information on. Because again, you're kind of in that scenario. I would say that you're a lot like Damar Hamlin, right? You're a young, healthy person who something happened. And it sounds like despite all the intervention and all of the testing, they can't put their finger on what it was. And that leaves a really challenging spot. I hear you. I wish I could say, I think it's probably X or Y. But it sounds like your doctors are kind of trying to be sleuths and figure it out. And at this point, they just don't have an answer for you. And at that point, I would say, let's get you into this group with other people who are like you, so you guys can have that shared experience and talk about how you're coping. Because that's a true a coping mechanism. Like, how do I deal with not knowing, but still living my life because I'm 23 and I'm healthy, right? Like that's
it's difficult.
Yeah.
The long story short, the difference between me and Damar is he got hit in the chest. I just woke up one morning and then I just woke up for school and then that's it. No impacts, no nothing, just randomly out of nowhere, gone.
Wow.
Yeah.
Yeah.
So
Yeah,
I just, I'm kind of aimless right now. Working a 9 to 5, seeing what's next.
Yeah. Well, good for you. Let's get you involved in the Young Hearts group, because I think you're going to find some folks who are like you and are, doing the same thing, working that 9 to 5, trying to keep one foot in front of the other. Knowing that this happened, but also knowing that you're healthy. So
Yeah, I think
Thank you very much.
Jamie is part of that young survivors group.
Oh, awesome. Jamie, I think you've been waiting to chat with us too. Tell us what you're thinking.
Hi, I'm not quite that young, but I had 45 when I had mine in 2020. So now I had mine while I was driving with my family, and I had my 2 young kids with me. So these situations with like Kristen Erickson, especially that day, I was at my son's baseball game, and my wife called frantic, asking if I was okay. And I'm like, is everything okay with you? Because I'm like, she was with my daughter, so I was like, this, maybe something's happened to the house. But either way, it just completely triggered her back to the day it happened with me, because she was the one that saved us with getting the car and CPR with me. And for me, you mentioned like not being there, you are sometimes immune to the actual idea of what happened. But I will have to say with Damar Hamlin, I didn't see it live. A friend, our sister-in-law, called and said, "Are you guys watching the game?" And by the time I flipped to it, it was already the group was around them and they were transporting. But I did accidentally click on a replay where they showed him collapse, and I remember seeing that made me feel like that's what my family saw with me. And even though I didn't remember it, I just think over and over, it's like they saw me there lifeless, and literally struggling for life. So it did re-trigger that idea, but my first thoughts was like, man, I hope this young man's okay, because there is life after it. And that's the key to all of it, for all of us to know that there is life after sudden cardiac arrest. But it did definitely trigger a lot of emotions from myself, my wife, even the kids started asking questions again about me and what happened. And is it similar to him? And, so it just relives it. And I'm assuming no matter how long I is out, I'm almost 3 years, and it seemed like it brought it back like yesterday. So
Really happy you're here, and thank you for, reaching out.
Yeah.
thank you.
That's so, Jamie, that's wow, that's that's kind of what we've been hearing. And that initial emotion of like, is that what my day was,
Mhm.
and then that kind of lived experience from the individuals who experienced it with you. If I'm getting too personal, you just tell me to stop. But
That's okay.
how did you and your wife kind of work through that? How did she work through that? Did she feel very raw? Was it, was there something that you think could have been helpful?
Well, we both have been pretty open with our communication during all of it. I saw therapy with my end and she saw therapy with her end, but we did come together to talk about both where we're at. And that day, especially with Kristen Erickson, we came home and it was like, we had a really long conversation about just being grateful that we're here to have that conversation, and just know that, seeing what he went through, we can't say we understand it because it's different for everybody, but we kind of have that idea of that initial shock of seeing somebody lifeless and then back to life,
Yeah.
But for us, it's been communication has been huge, to just talk about things. And sometimes it's hard to hear because, she hears my fears and things I go through, then I hear her fears and she feels like I'm blaming myself for what she went through. And it's like, I don't see it that way, because we're here together to go through those things together because of her actions. So, but talking about it helps tremendously. And I think this is a great place to be for people who have these questions and thoughts that come up, for sure.
Yeah. Jamie, I'll say, one of the interesting things that we're trying to learn so much more about and understand about is that dyad, right, between in your situation, you and your wife, and other people's situations, a parent, a sibling, somebody else who helped to resuscitate them, but that kind of shared experience, but the experience being so different. And as you were mentioning, you faulting yourself for what she's experienced. Sometimes we actually see some anxiety in the co-survivor that then translates a little bit into the survivor.
Absolutely.
Where there wasn't kind of an initial anxiety, but then it translates back and forth because, you're trying to kind of sort through this together. But it sounds like, you guys approach this incredibly well. But I think, again, this is an area that we're starting to learn so much more about, because those emotions that kind of, go back and forth, but are, very different, but very shared.
Right. And just the step of talking to each other was not easy. It was really hard. Yeah, it was definitely the hardest part. And we're still working on that. So it's not like it just went perfect. really had a hard time sharing our thoughts, more from her and to me, I think, because of the fact that she really felt like there would be guilt on my
Yeah.
end.
Mhm.
But it does help ultimately, because you just can't keep it in and never talk about it, because you have to at some point cross that bridge together, you know.
Right. Right.
We have a couple more questions there.
Yeah. Yeah.
Kathy.
Kathy, I think you've been waiting. Oh, did we lose Kathy?
Hmm.
Maybe we'll jump to Jean and we'll come back to Kathy.
Kathy's on mute.
Oh. Kathy, are you still there? Do you want to unmute?
There we go. Sorry.
There you are.
I was trying to get it. Okay, there. Can you see me too?
Yeah.
Yeah.
Okay.
So I'm at work, so that's why I had it the camera off too. So I'm kind of like Kyle, and I just celebrated on April 20th my 5-year rebirth of my cardiac arrest. My cardiac arrest is also unexplained. I see 2 different cardiologists, and I do have an ICD. They believe that I was just sitting at my desk doing work and just went out. They believe that mine is a rare genetic condition that my grandmother and also my 2 uncles also had. But back when they passed away, because they did not survive, they just said, oh, they had heart attacks. And that was it. I didn't suffer a heart attack. The interesting thing was, after all said and done, I never went to the ICU. I went to a regular room. The staff was like, what happened to you? I'm like, I had cardiac arrest this morning. Like, it didn't hit me at first because I didn't realize the impact when it happened, because I went to a regular room. They did all the tests. They couldn't find anything wrong with me.
Wow.
They actually, several days later, did my cardiac MRI, and they asked me if they could use my cardiac MRI as a teaching tool, because they needed to show residents what a normal cardiac MRI looked like in an adult. And I said, but I had cardiac arrest. My heart stopped. And they said, yeah, well, your cardiac MRI is completely normal. There's nothing, we can't find anything on it.
Hmm.
So they believe it's some kind of genetic condition that causes my heart to misfire. But I've had my pacemaker defibrillator now for 5 years, and it has never, ever been used at all in the last 5 years. So my battery life, they keep telling me, oh, you have another 13 years. I'm like, well, didn't you tell me that in the beginning? So like, it makes me happy and everything, but I still don't know what caused it. So they wanted to do some kind of test on me, which would mimic the cardiac arrest. And I said, no, absolutely not. I am not going through that in the recovery again, or risking damage to my heart. And I said, what would that prove? And they said, well, it might give us a name of what happened to you. And I said, I don't need a name. Rare genetic condition is a good enough name for me. So I do have that, when I see things like Damar Hamlin, that really upset me, because he's from Pittsburgh. I'm from Pittsburgh. I actually know people who grew up near him. His family's still here in the area. So the news media was very heavy in Pittsburgh about the whole situation because of his family being here. So I think every time you turn on the news, when it happened, that's all that was on the news. And like I said, I know people, my cardiac arrest happened here at work. I work at Children's Hospital here in Pittsburgh. So it happened. In fact, the other day I talked to the staff who saved my life, which, they're very humble, and they're like, oh, it wasn't just me. And I said, yeah, Jeff, the one nurse, is my hero, because he started CPR on me immediately, which helped me not have any cognitive damage. And I mean, they shocked my heart like 4 times to get me back into rhythm and everything. But the hardest part for me after recovery, I came back to the same seat, the same office, the same place where it happened. And that was very, very traumatic for me because I was sitting in my seat. Now I'm not in the same office now, but I looked next and I just looked over and that's where it was. That's where I was laying. That's where they were performing CPR on me. And so that part in itself was incredibly hard to come back to when I came back to work.
Wow. That is, I can't imagine. I mean, because that's every day that you're walking back into that scenario.
Right.
And kind of reliving the experience, which is incredibly challenging.
Well, and my coworkers, the other day, I said to my one coworker, I said, oh, today's 5 years. And she said, and I didn't say the date or anything. I just said today's 5 years. And she said, oh my gosh, I didn't realize it was April 20th. And I looked at her and she said, I will never forget the date. So like I traumatized all of my coworkers, and I kind of used humor to get me through it. And they would be like, stop it. Because it was upsetting for them because they witnessed it. They
Sure.
witnessed my cardiac arrest, and the staff that was performing the CPR on me and then shocking my heart, they almost had to tell my coworkers that I died because they said the fact that the unit director in the emergency department said that was the worst day in her entire career.
Right.
Like I was like, come on, there's horrible things that happen in the emergency department. And that was the worst day. And she said, yeah, because it was somebody I knew.
She's your co-survivor.
Right.
All those individuals are your co-survivors, because that was clearly that was a very impactful and I think you make a great point that sometimes you don't, how could you were in the thick of it, how could you recognize that other people were so impacted? And I think I think it's wonderful that she was able to tell you that was the worst day of her life. Because I think, as Jamie was pointing out, there's a worry that's a burden to you, but I think, again, you guys have this very shared experience that I think is really powerful,
Yeah.
I think you also, Kathy, you bring up a really good point too, which is, turning on the TV at that time, right? As somebody who might want to protect yourself from all of those experiences and those emotions and those feelings, and the current media is not going to give you that chance, right? It's everywhere, it's all over the news, and that's challenging too, to kind of figure out how to sort through, because it's not just that event that happened Monday. It was then everything there on out, and especially if it's, hitting close to home in Pittsburgh with the news media in Pittsburgh, I'm sure being very engrossed in it. And that takes a lot of resilience to get through.
And he was somebody who I watched play at the University of Pittsburgh, and, and the fact that coworkers of mine grew up with him and knew him, they were impacted greatly by it, because like they talked to his mom and everything. And, so it's hard, because I know one of my good friends grew up right next to him, lived next to him or something like that growing up. And he also witnessed mine. So like for him to witness that after he knew two people now, so it's hard.
Yeah. Well, thanks for sharing that with us.
You're welcome.
Tremendous. Let's keep moving, because I know there's other hands up, and I want to kind of hear everyone's thoughts, and we can definitely come back to some of these comments as well. I don't want to rush us, but I also want to give chances to everyone. Jean, are you there? Jean's also on mute, maybe.
Unmute her, see if that helps.
Hey, Jean, do you hear us? No worries. Why don't we, David, it looks like you've got your hand up too, so why don't we let David speak, and then maybe we'll circle back to Jean if she arrives.
Hi.
Hi, good to meet you. Sure can.
One thing that's concerned, I'm 8 years out from my cardiac arrest, and it bothers me that so many people in the medical profession have no clue about cardiac arrest. I was in the intensive care unit for 27 days in Vanderbilt. And I had nurses on the ICU say, "So when did you have your heart attack?" And I'd say, "Well, I didn't. I had a cardiac arrest." "Oh, same thing." And it blows my mind that I was in a cardiac intensive care and they don't know the difference. And I think also another thing that bothers me with the medical profession on this is doctors don't really know a whole lot about aftercare, I think, and the things that somebody that's had a cardiac arrest go through after the whole thing is, behind them, sort of. And I think, I don't know if they just don't learn that in school or what the issue, but it just seems that so many of them really don't know. They don't even ask you, about your emotions and your, how you're coping and all the medicines that you interact with that make you gain weight, some of them. And then they're telling you got to lose weight. I mean, there's just a whole bunch of stuff that plays into it that, and it seems there's maybe a lack of education or insight on the part of the medical profession.
So David, I would love to record your comments and put it at the top of a lot of our work. I will tell you, I think your experience is probably not unique. At scratching your head and saying like, "This is amazing. Why aren't you asking me the right questions?"
Yeah.
And I will tell you, from my own experience, I'm an ER doctor. I'm very interested in post-arrest care. I care a lot. I've spent a lot of time looking at what happens in the ICU. And when patients wake up and survive, we think, "Oh, this is wonderful. This is the best outcome we could potentially have." And we are now just learning. And I think we've kind of had some data, helping us to kind of think about what does it look like to survive. And we are now realizing how important that is. In 2020, the American Heart Association put an extra link into the chain of survival, and that link is survivorship. And so when you have those experiences where you say, "Gosh, did you miss this day of med school? Like, did you call out sick that day in residency? Because like, you're not getting all of this important stuff in my experience." You're totally right. And it's because we haven't dedicated enough time, and we haven't dedicated enough resource, and we haven't learned enough. And we are so trying to catch up right now. I will tell you, my colleague, Alex Presciotti, who's not on this call right now, but who I think you guys have met through CASA, maybe on a different experience, he is a clinical psychologist, and he came out here to Colorado to do his PhD. And I remember meeting with him about probably 6 years ago, and he was like, "These are super important things we need to invest in." And I was like, "Oh my gosh, you're so right." And he and a few other colleagues are really leading the charge to ask these important questions about not just survivorship and how do I remember where I put my keys and how do I go back to work or not go back to work. And you just gave me 20 medications and I took no medications 2 months ago. Not just that, which in medicine, we're really good at talking about medications and follow-up. We're not good at asking, "Are you sad? Do you feel hopeless? Do you feel lost? Do you feel scared?" We're not good at asking those questions. And we're especially not good at asking that when we look at the scenario and we're like, "Oh my gosh, you survived. This is amazing." And you're like, "Time out. There are other things going on here." And so, you're giving a very, very, very real response to what a lot of us are kind of trying to unravel and understand, and put together groups like CASA and bring you guys into this room and say, "Teach me, because if you teach me, and if I can learn from you, from your experiences, we can bring this back and we can teach our colleagues and we can learn more about it and we can develop tools and resources. And maybe discharge shouldn't be, and Alex has been saying this to me for years. He's like, discharge shouldn't be follow up with your primary care doctor, go see your cardiologist, maybe you need a neurologist, take these 25 medications, but discharge should be, let's have a conversation about how you're feeling about this today. Here's some mental health resources. Here's some strategies that we think might be good to help you kind of see the positives, learn from the negatives, cope, and then let's check back with you in a couple of days because we know this is evolving and survivorship is a process. It's not just thank goodness you made it out of the hospital. Let's go see a cardiologist.
Yeah, I mean, I've had very few questions asked. Like a lot of people, I had hypoxic or anoxic. I've heard it called both, brain injury.
Yeah.
I've got some real cognitive issues on short-term stuff.
Yeah.
I have a little bit of balance issues on one side. I guess it's much like having a stroke, but I was on the ground having CPR for almost an hour before an ambulance got there.
Yeah.
And my cardiologist at the time couldn't believe that I woke up again. But nobody asks you about the cognitive issues and how you're dealing with it. Nobody says, gee, maybe you should go see a neurologist or neuropsych person or anything like that. I've never had something like that recommended to me. And I've often wondered maybe if I should go see someone like that. And there's times I get so forgetful, I think, you know, I'm getting older and maybe I got Alzheimer's, but I don't. I'm quite sure I don't. But everyday things, you know, where I put my phone down, where's my phone? You know, I have to keep a lot of lists. And if it's something that was 5 years ago, I remember it clear as a bell. If it's something that was today or yesterday or 10 minutes ago, I just met a new neighbor and I have no clue what his name is. He told me twice. But you know, you live with that. And, you know, I'm very thankful every morning when my eyes open that they did open. I had a heart attack when I was 45 and a friend of mine did too. He said, why aren't you bitter or anything? I said, man, my eyes opened this morning, you know, what's to be bitter about? And same thing with the cardiac arrest. It was a big challenge. I mean, I was out of it for quite a while. And I was in a coma for a month. It was not something I want somebody to live through, but I don't remember it anyway. So, you know, I lost probably 3 months that I have no memory of. But to me, most of my doctors are very concerned about my heart or my lungs or, you know, that, but not the whole package. And that there's got to be more. People have to invest more in asking about the whole package, I think.
I do not disagree with you at all. I think you are spot on. And, you know, there are some of my colleagues that are trying to put together a multidisciplinary clinic, you know, where you're not just seeing a cardiologist and a lung doctor, but you come in and you do see a psychologist and you can have neurocognitive evaluation and those sorts of things all kind of come together into these post ICU clinics. But, you know, those are few and far between. That's not the norm. And so I think, you know, we need to do better because, you know, just because you can put something like that up in the ivory tower doesn't mean that everyone who's, you know, getting their care.
And your doctor see you walk into the doctor's office and, geez, you look good, you know, and you carry on a conversation with them and they're kind of surprised you can even converse with them. I was fortunate at the time that I had my cardiac arrest. I ended up in Vanderbilt Hospital, which is a great place to end up for pretty much anything. I've since moved to Florida. And while I'm happy with my medical care here, they're really stressed here because Florida has grown so quickly over the last 5 years. And doctors are in real short supply here. I mean, I talk to people that can't get an appointment to see their cardiologist for 5 months. And it's like, it's not the same as when I was in Nashville, although Nashville's gotten so huge too, it's probably the same there now too.
Yeah.
I don't know.
Yeah. No,
I don't
these,
think they look at the whole self as much as they should, and they look more at, gee, you're walking, talk, your heart sounds good, your lungs sound good, and see you in 6 months. I just
Yeah.
saw my cardiologist yesterday, actually. And I go back in 6 months. Was there for 15 minutes.
yeah. No, you make a great point. I would love to keep you posted too on how the progress we're making, because you're completely outlining a problem that many of us have identified,
Sure.
and want to do better. Really want to do
I
better.
think anyone who's a long-term survivor probably has the same feelings on it because they've gone through the same things, unless they're very fortunate and have had a different outcome. But
Yeah.
I think it's probably a common thread with everybody that's gone through this.
Joe's trying to get our attention.
Okay, I'll give up the mic.
Hey, David, I totally concur with you. I'm coming up on 15 years post cardiac arrest. So it's interesting that you bring this up. I was fortunate that my EP cardiologist and my regular cardiologist and my internist, the first time I went to see him after my arrest almost 15 years ago, they actually asked, "How are you feeling?" And I was going, "What do you mean? I'm just glad to be alive."
Yeah,
You know, but as time went on, I realized I want to share a quick story about co-survivors. I was invited through Mary and the American Heart Association to address the scientific sessions. I believe Mary was at 2017, 5 years ago.
Yeah, I think so.
And my wife is a retired physical therapist, as I am also. And she doesn't like to talk about this cardiac arrest business because she was there when I collapsed at a friend's home. And she used to work in intensive care at Mass General Hospital. So she knew the scenarios. You're going to die probably within 72 hours. You're going to be cognitively full care nursing home for the rest of your life. The third scenario is going to short-term rehab, or you're going to go home with an ICD. So, that I was lucky that I had this advocate, my wife. But what I didn't realize, David and rest of you on board here, is that 10 years later, when I was asked to speak with my wife, Edie, as a co-survivor, and she spoke, I think, probably for the first time at a conference about co-survivorship, thanks to Mary and the American Heart Association, I had blown it. To me, she said to 2,000 people, "This is not Joe's story. This is my story. He was in a coma for 3.5 days. He doesn't remember the year before his event." And I still don't. I've kind of pieced together because I'm looking at emails, but I'm very fortunate, David and group, that I don't have any memory issues or any physical things. But one of the things that really slapped me in the head, and I can't remember
What
who.
about your memory issues?
Yeah, I love, you're still pretty quick, man. But I think that I'm embarrassed to share the story, but I want to share the story because it took me 10 years to realize how impactful my cardiac arrest was on my wife and my 2 grown daughters who are 40 and 38 years old. They cannot talk about it to this day. And it's really an interesting phenomena. And I really also think that I can't remember which gentleman here brought up, I should have written it down, about communication with his wife. Was it not Kyle?
Jamie.
Jamie.
Yeah.
And I should have written it down. See, maybe I do have some short-term memory issues, David. But communication in the last 5 years has been unbelievable with my wife. But the first 10 years, it was swept under the rug. And again, it's that we got to talk. And I think part of it is being involved with groups like this to share stories. Anyway, that's kind of my brief story about co-survivors. And, you know, my wife has spoken at another event or two about co-survivorship, and she said, I can't do it anymore. It's too tough on her because the PTSD and anxiety affects her an immense amount. And, you know, was a highly trained healthcare professional as a physical therapist. So she's seen people die in ICUs and all that kind of stuff when we were at Mass General Hospital. Anyway, enough said. Thank you for all your comments. And I don't know if Kathy can hear us. She's still has a hand up. I'm sorry if I got ahead of you, Kathy.
Thanks, Joe. Kathy just posted, so maybe are you able to speak with us, Kathy? I can read your post as well, if that would be.
Yeah, I just was saying that, you know, I know a lot of you were talking about the mental health part of it. And I know, like, I saw my PCP, my doctor, probably about a week after Damar's thing. And the very first thing my doctor said to me when I walked in is, how are you doing? Were you watching the football game when it happened? And because knowing that I am a big football person. So like, I'm lucky that my doctors are all very in tune and always are checking on my mental health, because they know that it really did bother me. In fact, I would say about 6 months after I had my cardiac arrest, I did go seek help because I didn't know what was wrong with me. And it was because I was having the post-traumatic stress. And, you know, so I'm lucky that I do have that support, but I know a lot of people don't. And it's kind of scary that people aren't being asked how they are, because it really affects all of us. Like, it's not just the person it's happened to, but it's people around them.
I think Matt Wood had a good comment. Do you want to share that, Matt?
Thanks, Kathy. That's I think you're echoing a lot of what David and Joe had just said as well, that, you know, we need to ask.
Thanks, Mary. I just had mentioned in the chat, and I'll just kind of expand upon it, but you know, when we look at the care, and my background's in healthcare communications, so I kind of focus in on those things. But when we look at the care perspective and the handoffs of care, at the point in time of discharge, essentially you're left without any further thoughts other than the follow-ups with the cardiologist and your primary care. There isn't considerations as to what it's like to be a survivor, what experiences other survivors may have had, or even the acknowledgement of a co-survivor in your family that may have, you know, be struggling with through. And I think at the time of discharge, yes, there's a lot of things going on with medications and such, but people take those discharge papers home and sit with them for, you know, hours, days. In fact, I still have mine from my 3 episodes in the hospital that I refer to, and whether it's the medications or the follow-up pieces or just what was discovered at that point in time that I refer to. And I don't know if others do as well, but I think there's a missing element in there to where, yes, they make the recommendations for cardiac rehab. Cardiac rehab, I've been in both in a heart attack, post-heart attack setting and post-cardiac arrest setting. And yes, the cardiac rehab seems to be more tailored to the heart attack or the person who may have had an operation or heart surgery, but still fails to think about the whole person from mental health perspectives, fatigue that goes on an ongoing basis with survivors, or even the emotional stresses between whether it's the survivor or the co-survivor, and kind of reliving those experiences on a day-to-day basis. And I think the last point in contact, or probably the most effective way to get that word out, would be to include some very simple things in discharge instructions, including resource groups. This is something that I would think that care managers, that when they call you up to say, are you taking your medications as prescribed? Because I certainly had those visits, and I don't know if anybody else did. Again, a missed opportunity by them to ask about, you know, well, how are you feeling from a mental health perspective? Or, is there, any needs for anybody else that may have experienced the traumatic experience in your household?
Those are excellent points. And we have our work cut out for us. We have marching orders, which I think, you guys are helping us to recognize the need, the importance, and as you mentioned, Matt, I mean, the missed opportunities are just too numerous. I'll tell you from our perspective, we have done some qualitative research with decision makers, and the number of those folks who I've reached out to from a research perspective who have said similar to what you're saying, kind of pointed out and said, hey, do you have some resources for me? With my researcher hat on, I'm thinking, oh my gosh, we failed. So I think, you're pointing out some really good opportunities, the discharge instructions, those medication follow-up calls. And I think even, we give a lot of expected management, right? You've just had surgery, you're going to have a little bit of pain for the next 12 hours, maybe the next 2 days, call us if you have a fever. In cardiac arrest, we don't do that for kind of re-engaging into your world. And I think that's a huge missed opportunity, Mary Jo, sorry. Do you guys have a comment? I saw a microphone go on.
I'm Linda Meaner. It says owner. Do you see? Can you hear me?
Yes.
One thing I want to do is thank this group. It took us 2 years to even know what to expect. And I'm so sorry. The last group, they mentioned the Ted Gilliam book, Observations of a Sudden Cardiac Arrest Survivor, or What I Wish I'd Known. I had been told when I was discharged. I am pushing this at every doctor's appointment that we go to. And I've asked them, if you can't get a group together for us, at least hand this book out to people.
Yeah.
One cardiologist is now working with us, and our primary care doctor has also come on board.
Yeah, that is a great resource.
But we didn't even know that Dave's heart, we didn't even know that Dave's heart was involved. They told us it was blood clots in his lungs that caused this. We never saw a cardiologist until I asked 2 years later. So thank you very much.
Thanks, Linda. Thank you.
Yeah. We're glad this has been helpful.
I think these are great conversations, because I think it's important to learn from each other, and to kind of seek all of these resources and learn from others' experiences and help. I think a lot of times when we're struggling, to feel like you can provide support and help to another is a little bit of a healing process as well. So I appreciate Linda, I appreciate your comment. I appreciate all of your comments. I think this has been a really tremendous hour. I'm biased because I think this is such an important topic, but I think it's been a really tremendous hour to hear all of your perspectives and learn from each other. Is there anyone else who wants to say anything? I think we're at the end of our hour, so I don't want to take up too much time. I want to make sure that we give everyone an opportunity to talk and circle back if anyone wants to share some other thoughts. Yeah.
I'll share something real quick. And Mary, I don't know if this is outside the rules, but my name is Joe Fisher. I'm a sudden cardiac arrest survivor. And I'm a psychologist. And I can agree with everything everybody has said. I can assure you that as a psychologist who suffered this event, there's not a whole lot I could do other than get therapy for myself, because you can't really treat yourself, right? But I just, for the good of the group, I recently read a book called Anchored by Deb Dana, who is a she works with something called polyvagal theory, which is basically all about how the autonomic nervous system works and why, as human beings, we have these types of reactions to traumas. But it's a very practical book in terms of kind of getting your autonomic nervous system kind of back on the rails. I think anybody that's been through this, a lot of the things she's suggesting you'll be familiar with, some you probably won't be, but it was just a very good title for me to read. So.
No, we could probably start listing some of these resources in CASA, these books that might all be helpful to all of you. So.
Yeah, I think that would be a great suggestion.
Mhm.
Can I
One of the
urge
things
it?
maybe, Mary, we could think about is like a book club.
Yeah.
Maybe we could all read something together and come back and chat about it.
Yeah.
I think there's another book that I read about 8-9 months after my cardiac arrest called The Survivor Club. And it's written by Ben Sherwood, who was the former president of ABC News. And he went through a lot of survival training, similar to what the Green Berets and the SEALs did. And he's interviewed hundreds of individuals who've really had survived traumatic events. And one of them was sudden cardiac arrest. And I think it's interesting that if you buy the book, again, it's called The Survivor Club by Ben Sherwood. There's a psychological test that I took, and it was really phenomenal how, and I verified the validity of it just for one person, me. I had my wife read the summary. She goes, "Oh my God, that's you."
Mhm.
And it really helped explain to me, I had survivor guilt, like why I lived, I think, besides the good Lord putting people into CPR and paramedics close by to me. But it's a really good book. I urge you to pick it up and try to read it. There's a lot of great resources. And Sarah, I love your idea of doing a book club. And one last note is we do have a resource section on the CASA website, and one relates to aftercare that was written by Dr. Ancardosi from University of Pittsburgh, and they're really leaders in post sudden cardiac arrest care, which, as you all know, is a journey. Thank you.
I guess in closing, I wanted to mention that, oh wait, Kyle has a question. Never mind.
Sorry to interrupt. I just wanted to know what all those books were again. I mean, we all got short-term memories, so I didn't get the chance to write them down.
Okay, I'll send that out to all of you. Okay.
Appreciate it. Thank you.
Yeah. I was just going to say that our plan is to have these meetings once a month. And our next one will be on exercise after cardiac arrest led by Kate Flickinger, who's a PhD in exercise physiology at the University of Pittsburgh. So we'll post that up in the event section, but it's right now scheduled for May 30th. So anything else, Joe or Sarah?
No, I just want to thank everyone. This is really, every time we all get together on a monthly basis now, it's our third session. It's the depth with which people are participating and asking questions and sharing their personal experiences is just phenomenal. We'll keep it up. We'll keep it up. Okay.
Yeah, I wanted to thank you for all of your comments and for your willingness to share and be vulnerable. So thank you for this hour. And I want you to know that I hear you all, and we are working towards ways to better support. So hopefully we'll be able to report back with progress soon. So thank you.
Thank you, everybody.
Thank you.
Thank you.
Take care.
Thanks. Take care.